Good morning. For those of you who are just joining us, we're going to take a minute to allow others to join us, and we'll begin this morning's summit shortly. Thank you for joining us this morning. We'll give it about another 30 seconds. Well, good morning again, and greetings and salutations, and welcome to the 10th Annual Dallas Hunger Summit, Top 10 Hunger Solutions, a holistic approach. We want to thank everyone for attending this morning's session. My name is Mark Edwards, and I am the administrator for the Dallas County Health and Human Services Older Adult Services Program. I'm also a member of the leadership team for the Dallas Coalition for Hunger Solutions. In 2011, the Texas Hunger Initiative joined Congresswoman Bernice Johnson and multiple public and private entities to organize the first Hunger Summit in Dallas. The goal was to inform the public and concerned leaders about the problem of hunger and food insecurity, and to invite everyone to be part of solving hunger in our community. Since then, the Dallas Coalition for Hunger Solutions was established and has brought together over 250 organizations and individuals to develop ideas and implement strategies to reduce food insecurity. The Dallas Coalition for Hunger Solutions, chaired by Congresswoman Johnson, has guided by leadership team, continues to hold the Dallas Hunger Summit each and every year. We would like to thank the members of the leadership team for helping to organize this year's summit and for providing direction for the coalition. The mission of the coalition is to empower all Dallas County residents, all Dallas County residents. That's all Dallas County residents to gain equitable access to healthy food. The plan is to create and sustain action teams that focus on priority areas of child hunger, senior hunger, faith community hunger solutions, public policy and advocacy, and urban agriculture. Together, we work to reduce food insecurity through a collective effort and have the greatest impact. Access to healthy food is such an important issue for our youth, families, and older adults. We know that too many of our neighbors are struggling with having enough nutritious food to eat. We also know that access and having a good nutritious diet helps keep us healthy, and that lack of access and poor diet can lead to disease and multiple health disparities. Throughout this year's Dallas Hunger Summit series, we are examining how to create a more food secure and just food environment for everyone through the lens of our top 10 hunger solutions. As with every problem, food security is complex and is not as simple as providing food. Rather, we need to collectively work on all 10 of these approaches. Our Hunger Summit series opened 2 Fridays ago with a panel representing multiple community sectors. They discussed how to solve hunger and impact community health in an all-inclusive way. The following week, we had a conversation about public policies that create barriers and keep many of our neighbors trapped in circumstances of poverty, when there are concrete steps that can be taken to end poverty for good. Today, we'll hear from a panel of local practitioners and innovators about their initiatives to create equitable and effective community solutions for food insecurity, food waste, and food deserts around Dallas. We are recording today's presentation, and everyone will receive a link to the recording and a follow-up email in the next few weeks. At this particular time, I'd like to acknowledge Congresswoman Bernice Johnson, who is in her 15th term in Congress representing the 30th Congressional District of Texas. She was also instrumental in launching the coalition as coalition chair. Her support has made the coalition's accomplishments to date possible. Let's listen to what she has to say to us this morning.
Hello, I'm Congresswoman Bernice Johnson, and I proudly represent the 30th Congressional District of Texas. Welcome to the final session of the 2021 Dallas Hunger Summit. I'd like to start by thanking everyone in attendance today, and a special thank you to those who have also attended the last two sessions. Texans have done some truly amazing things throughout history. It was a Texan who created the semiconductor chip, the same chip that's powering the device that you're watching today. It was a Texan and a Texas president, Lyndon Baines Johnson, that signed the Civil Rights Act of 1964 into law. It was a group of Texans at the Johnson Space Center who were instrumental in helping the United States reach the moon and win the space race. So when people tell me that we can't solve statewide hunger or that we can't provide equal access to healthy food, I don't believe them. If there's one state that can solve these issues, it's Texas. Today, we will hear from those at the forefront of the fight against food insecurity right here in Dallas. In Washington, I have been working with my colleagues to address hunger issues at the federal level. That's why I fought to include a temporary summer EBT program in the CARES Act, which was signed into law last year. And now I'm working to make that program permanent. This year's defense policy bill also included a first-of-its-kind basic needs allowance for military families struggling with food insecurity. We're also looking at legislation that would expand SNAP eligibility to make it easier for both college students to receive benefits. I look forward to a productive discussion and hope we will learn more about the ongoing efforts in our community.
Thank you so very much, Congresswoman Johnson. Your leadership and support for the coalition is greatly appreciated. It is encouraging to be with the many organizations and community leaders joining us online today as we prepare to hear a robust conversation about best practices, innovations, and collaborations underway to improve food security in Dallas. A number of organizations have stepped up to provide financial backing to make this event possible. We want to give a special thank you to the 2021 sponsors, the National Council of Jewish Women of Greater Dallas, the Episcopal Diocese of Dallas, North Texas Food Bank, and the United Way of Metropolitan Dallas. We appreciate your continued partnership in this effort to educate the community and advance food and financial security for all of our neighbors. Now to the part of the agenda that we've all been waiting for, addressing food insecurity and healthy food access, Dallas area initiatives and best practices. It is therefore my privilege and pleasure to introduce Dr. Doric Earl, our panel moderator this morning. He is a professor at Southern Methodist University in the Meadow School of Arts, a SMU Hunt Institute Fellow, and an expert on social entrepreneurship. He consults with nonprofits and communities to help them achieve collaborative, engaging, and sustainable solutions to seemingly intractable social and economic problems. Dr. Earl will introduce our panelists, and I invite all of our attendees and audience to write any questions that come to you during the panel presentation in the Q&A box. We'll answer as many as we can. So without further ado and delay, I'll turn over this virtual floor to the fabulous, magnificent, and wonderful Dr. Earl. It's all yours, Doc.
Boy, that's a high bar I'm going to have to stay up with. Thank you, Mark. Thank you all. I really appreciate the opportunity to work with such an esteemed and really hands-on panel. Sometimes in academia, we get obsessed with the theory. Here we have the practical. We have people who are working day in and day out to solve the intractable problems of hunger. So without further ado, I will go through and introduce our panel. And then after introductions, I will ask each panelist to present their thoughts and their work around this. And then we'll have a series of questions. And then we'll open it up for Q&A with our audience. So without further ado, let me introduce our panelists today. Dr. Edward T. Rincon is founder and president of Rincon and Associates, LLC, an adjunct professor at the UT Arlington College of Business and the author of Culture of Research. He is a research psychologist with over 45 years of experience studying general population and multicultural consumers in major US markets. Dr. Rincon developed an urban site location dashboard, an innovative new app that will cause us to rethink food deserts. And I took a peek at that as a former technologist. I think it's fascinating. It's worth learning a bit more about that with Dr. Rincon. Dr. Owen Lynch is a co-founder of Restorative Farms in South Dallas, of which I am also a co-founder, a self-sustaining nonprofit farm that grows local food and trains and grows local urban farming professionals. He is active in Dallas on healthy, fresh food access and food justice issues and has served on several food security committees and city food interest groups. We will hear about how lives are being changed by this project in South Dallas. Laila Alucresh is the former Chief Innovation Officer for the City of Dallas, although she is very innovative, absolutely. In her role as the inaugural leader of the city's Office of Innovation, she was tasked with identifying and scaling creative ideas that work throughout the city organization and implementing solutions in partnership with internal and external stakeholders. She'll talk about a couple of creative ideas implemented during her time in the office. And Ashley Douglas is a senior director for the Southern Dallas Thrives at United Way. She oversees this work in partnership with PepsiCo and Frito-Lay North America. This initiative is innovative in its approach to cross-collaboration between corporate and philanthropic participants in solving complex societal issues in education, income, and health. And as a professor that teaches social impact and works with many nonprofits, that site is very helpful and I would say very important to look at because it shares some very important numbers that show the impact that can be derived from programs like this. So it's really important. I try to teach my nonprofits to actually collect data. Looks like they've collected a lot of good data. And Pastor Darrell Carter shepherds multiple ministries in Carver Heights Baptist Church and South Oak Cliff. His church provides relief for social and economic challenges faced by its neighbors, young and old. Despite setbacks from COVID-19, the pandemic, and the winter storm Uri, the church has persistently continued to assist its neighbors. He'll tell us how he does it. And Alexis Baker, from City Square Food Recovery Manager, joined the organization in 2019 to develop, implement, and operate innovative new food recovery program. Her experience of a wide variety of culinary industries includes working in research and development to create innovative recipes, then producing, testing, and executing new product lines. We'll learn more about how her program repurposes food for our neighbors. There's absolutely a wonderful NBC5 clip about her kind of looking like the Iron Chef for City Square, taking the food that is available and turning it into wonderful meals for our community. So welcome all. Welcome panelists. And per our script, I'm going to ask Dr. Rincon to kick us off with his presentation.
Thank you for the introduction, and I will take a moment here to search for my screen, my presentation. Hopefully this will work effectively. Well, I think that was the wrong one. Let me see. Okay. I hope the screen is visible to everybody. And can everybody hear me okay? My audio is all right? Okay, thank you, Dr. Earl, for the introduction. I'm happy to be able to share some information this morning with you about our urban site selection model. Our company has been in the business of research as well as in innovating technological solutions to many of the quality of life issues that are presented to everybody on occasion. We have been, of course, involved in research for the past 45 years. Much of our research is focused on multicultural populations here in the US. And over the past years, I have had a good share of experience with food consumption, mostly in the retail area. We've done a number of trade area market studies for major supermarket retailers in the North Texas area. And it wasn't until more recently, in the past couple of years, that my research focus was directed to food insecurity, disease trends, health disparities. And it's so I'm not necessarily a food insecurity expert, but I certainly have taken a lot of interest, and my research has developed some new insights. We all know that food deprivation is accelerated in a big way from with natural disasters. We certainly have witnessed what is done, what's happened to our food deprivation in the Dallas area due to the pandemic. Historically, interestingly, food deprivation has also been used as a weapon in times of war and conflict to defeat the enemy. And of course, we're not as focused on that right now, but the presence of food deserts actually has almost a similar effect because it significantly contributes to the food deprivation problem. We all know, I think by now, that food deserts are very harmful to our communities. They lead to higher prevalence of diabetes, obesity, coronary heart disease, and various other health disparities. They also, in a big way, discourage economic investment in the communities where they're located. We also know from research that it leads to cognitive deficits in school children, a real huge problem. But really, what happens is the question that we have to ask, though, is why are they continuing? Why have they persisted? The problem here is that they are also concentrated in communities of color. This is a map that shows the green areas show the concentration, the distribution of food deserts in Dallas County, with a focus on the city of Dallas. Half of the 88 food deserts in Dallas County are concentrated in poor Black and Hispanic communities. The question we should be asking is, why have these food deserts persisted for decades in South Dallas? That was part of the research that I think that we focused on. But as we started trying to understand the nature of this persistent problem in South Dallas, I sought explanations in the research and talking to community people to try to get an understanding. And what we came across is a variety of reasons that are given for the persistence of food deserts, like perceptions of high crime rates in the southern sector. I call them perceptions because our research did not really confirm that. The perceptions of lower profitability, biased media coverage, the media coverage that usually talks about issues related to food insecurity are usually slanted towards talking about the struggles that communities of color experience from food deprivation and food deserts, but they typically celebrate the arrival of a new supermarket chains into this area, but they typically do not address the exclusion and the reasons for exclusion of South Dallas food deserts from these new entries. The focus on social rather than economic assets, the questionable investments, public investments that are made in the past, and we'll talk about the potential for retail redlining practices. And of course, one of the main things that I will emphasize towards the end of my presentation is the complete absence of a market demand study in South Dallas. I've done a number of studies in the retail industry in past years. It always starts with some basic research on market demand, trade area analysis, and other types of research to understand communities and their needs. No such study, to my knowledge, has ever been conducted in South Dallas to this date, which led us to initiate the study of South Dallas food deserts, and because it did challenge the traditional thinking about the opportunities there. We focused on crime rates, looking at the Dallas Police Department crime files, and violent as well as property crimes. And we did not, we concluded that the crime rates were not substantially higher in the southern sectors of Dallas. We looked at economic indicators, including aggregate household income, which is employment income, food stamp benefits, and number of household members. These were stronger predictors of food and home expenditures than traditional indicators like poverty rates, unemployment rates, and median household income. We also, this research led us to develop the urban site selection model that identified several food deserts that revealed sufficient economic potential to sustain the annual sales of a mainstream supermarket of different square footage sizes. This was quite a bit of surprise to everyone that read our study. And but unfortunately, what happens in the real currently is that even the food deserts still persist, and they're still, and even in the midst of finding economically promising zip codes like zip code 752 and 75216, which are circled here on the left side of this map. This is where two of the most promising zip codes exist, and you can see on the right side of the map that there's a complete absence of mainstream supermarkets in those two zip codes. And why do we think these zip codes are promising? Well, in a separate report, and when you review a copy of these slides later, you'll be able to appreciate the detail that is apparent here. And you'll see that along the top column, what we did is a profile of the economic characteristics and demographic characteristics of two of the zip codes that were targeted recently by HEB as they entered the North Texas market. And those are 75093 and in Plano, 75034 in Frisco. And I also compare that to the two zip codes in South Dallas. So very quickly, we can see, for example, that yes, there are higher medium household incomes in the Plano and Frisco area, and the lower ones in the South Dallas zip codes. But when you look at aggregate household income, there are millions of dollars being earned in those communities. There's also millions of dollars coming into the South Dallas zip codes from SNAP food payments. And you look at the bottom line here, you'll find what's really interesting is that our estimate for how much the money they spend for food at home in those communities is quite different, but in some ways quite similar. You'll see that for the two HEB targeted zip codes in Plano and Frisco, there's about $136 million and $295 million that are being spent in those communities. But that money is being divided by competitive stores. In one community here in Frisco, in Plano, you see that there are already 6 competitors in that market and 7 in the Frisco market. But in the South Dallas market, there's only like at most 1 supermarket there. So the bottom line is that money is going to be distributed in various ways. And you can see South Dallas still has some significant dollars that they're spending on food at home expenditures. But for some reason, it doesn't seem to capture the attention of this mainstream supermarket that's growing in North Texas. And it's probably not a coincidence that the communities that were targeted by HEB in Plano were predominantly white and Asian, as you can see in these red lines. And then the communities that were avoided by HEB were predominantly African American and Hispanic. So is this retail redlining? I think it's certainly suggestive of that, but it's certainly something that we need to keep an eye on, because unless we start to intervene and focus attention on that, we may not be able to ever reduce the number of food deserts, and they may in fact be growing larger into the future if our economy doesn't improve. Here is a snapshot of just the urban site selection model. Based on the research that we did, we basically, this is a prototype that we put together using Tableau technology. And what it does basically is allow any user, it could be an investor, potential investor, or it could be a person who is just looking to, a non-profit organization that's looking for opportunities. And what it does, it makes you do three things. Select the annual food at home expenditures that you believe are going to be, let me just go ahead and bring up the actual website. Hold on a second here. Okay, this is the actual website that's it's available to anybody. And you can see here that what it requires you to do is put in an amount. Say $20 million was entered here for the estimated amount of how much money is estimated to be spent on food at home expenditures. And here you can select whether you want to see just food deserts or not food deserts. Okay, and Dallas was already pre-selected here just for convenience purposes. And you can see that it tells you which census tract qualifies. This census tract here qualifies. It has an annual food expenditure of $21 million a year, and it happens to be a food desert. And what's even more informative is you get.
Ed, I don't know if you can tell, but we actually can't see the.
I was just going to say, Dr. Rincon, it didn't switch. You didn't switch screens over to.
Oh, well, okay. We'll just go back to the presentation
But we'll post obviously the link so people can go and test it, play with it.
Okay. Well, I'll go back to the presentation, and hopefully we can just finish our discussion. But let me see. Let me try to get back.
It's like a lobster trap. Once you're in, you're done.
Yeah, I'm trying to see what
Now you've muted, sir. There you go.
Can everybody hear me okay?
Now we can, yes.
Okay. Well, I'll just finish my my discussion by saying that the whole point of the urban site selection model is to allow people to identify food deserts that do have the economic potential to sustain a supermarket with the specific sales. And what does that do? I think it basically empowers everyone to not just focus on temporary solutions to the food hunger and deprivation crisis that we all experience, many experience, but to also put pressure and to encourage or require supermarket chains to invest in these communities. Because indeed, the perceptions of crime are not substantiated by our research. The poverty statistics they may be there, but they're not relevant to food expenditures because, hey, we all have to eat. And what determines more what you're going to spend on food are three things in our experience. It's going to depend on the amount of food stamp expenditures that you qualify for. It's going to depend on the household size. The more people, the more food is going to be consumed. And it's going to depend on what we call aggregate household income or buying power, a crude measure of buying power. Those three factors determine more than anything else how much money is being spent in a community. That information, ironically, is in the public domain. We just did this urban site selection dashboard out of our own resources to just show how effective this can be in guiding people towards food deserts that have economic promise. They may have other things wrong, but many of them do have earned income, food stamp dollars, and other assets that can sustain a supermarket. So we do really need to focus attention on the supermarket industry and put more focus on entering the places like South Dallas. So I'll end my discussion at this point and save any other questions for later in the later discussion.
Yeah, we do have a couple of questions that we'll follow up with about the types of stores that you identified and some whether those types of stores prevent the mainstream chains coming into the neighborhood. But we'll follow up with that. Thank you.
That'll be interesting. Yes, there's a lot more to discuss, but in the interest of time, we'll just follow up later on that.
Beautiful. And really appreciate your research. It's fascinating and very timely.
Thank you.
And Dr. Lynch, I believe we would like to hear from you if you have a presentation. Or, oh, beautiful.
Can you guys understand? I just had unplanned dental surgery early this morning, and I'm hoping I'm clear because my mouth was all numb. So am I understandable?
Yes.
Okay. Thank you, Ed, for that presentation. And thank you for inviting me, Laila and Bella, and thank you.
You're quite welcome.
So I'm just going to be relatively brief, and I'll just show. Can you see that, Doric?
Not yet.
Okay. Hang on a second, please. It should share screen. Okay, now I have the green box. You should see it, correct?
We got it.
Okay, I'll be relatively brief, and I'm happy to follow up further with any questions and discussions, and yield my time back to the panel as much as possible because I want to hear from everyone as deeply as I can and learn today. So I'm representing SMU, obviously, as a professor, and they've supported my community-based research for a long time. And this project emerged out of participatory research, working with the community. And as community growers asked, and we're looking into, can we build a viable agri-system in Dallas, but specifically in South Dallas, where the need is the greatest. The need not only for local access to food, production of food, but also the production of jobs. And South Dallas obviously has some fantastic assets. The neighborhood is typically framed by what it doesn't have. And Ed hit on some of the things today that they actually have more that people constantly frame this as a community without, but it's a vibrant community where people are living, and it's been disinvested wrongfully for a long period of time. If you look at the 1929 redlining maps and match them up to the food desert maps today, they still correlate perfectly. So we're looking at opportunities and assets that we can build through an asset community development map. And we were really looking at food production in South Dallas as creating a local agriculture system, as well as economic development and a catalyst for change. Working with partners like our partner here, Tyrone Day, who's head of our farm systems and training program. He's from the community and had a horticulture degree. And he's really the linchpin of the community level change and training that has happened through our model. So what we were looking at, and we mentioned this earlier, is that we do need to have better distribution and aggregation in Dallas, but currently there's not enough to actually aggregate and distribute. In other words, we have a large, we don't have the large scale supply that will actually create a market and therefore fit market demand of local grown produce. And so if that's the piece where we decided to focus our energy, how can we grow locally? How can we grow better, healthy food? How can we reduce the price of that food and increase access whilst also simultaneously creating jobs and training. So to do that, it's a network. We did a network approach because a systemic problem requires a systemic solution. And we looked at market-based scalable solutions around the country and then figured out what would best fit the current Dallas landscape. We brought in community partners like Fraser and others. We started our first farm at the MLK Community Center to increase access. We also brought in agricultural experts to make sure that we are focusing on yield and producing lots of food. Community gardens, as the John Hopkins study illustrates, are wonderful for building community, but 90% fails in the first year, and hardly any produce enough food to feed people for more than 2 weeks a year, feed more than 10 families a year. So how can we actually increase yield, and what has worked around in other cities? So looking at that model, we drew up value propositions. We worked this from the whiteboard that we started in 2016 with the community. And the goal ultimately was to create a seedling farm at first, which you see here, which would then create a hub for experts and take care of the largest input problem, which is access to healthy, fresh seeds, to make sure that people had seedling plants so that they could have successful growing, because that's the largest cost and the thing that people least know. What should I be growing right now? What varieties work? And that's the point where you can crop coordinate, crop manage, and crop train. We're handing community members the plants that they need to grow well, whether it be in a grow box in their back porch, or whether it be at a school or a church garden. And currently we're supplying about 14 major community gardens, school gardens, 4 farms, about 40,000 seedlings a year out of the seedling farm at the MLK Community Center. We're also looking at when we built a training farm that would increase our place to provide expertise, hub materials to lower costs, aggregate and take care of some of the high threshold problems, market transaction problems. And so we then started the training program at that farm. And the goal is to ultimately create 10 to 20 franchise type farms off the Hatcher success, or the Hatcher model that we have now. And I'll show you some of that today. The goal will then went on to talk about, we have 2 distinct goals, basically, of linking what has largely been 2 interdependent, but yet separate marketplaces, the North and South Dallas. As Dr. Rincon was showing, there is money in South Dallas to be used. Unfortunately, many of the community have to leave their community to go buy groceries, as well as get healthcare, as well as many other necessities of life and jobs. How can we bring these 2 markets back together? How can we grow in South Dallas, utilizing all the local assets, create a local economy through food, making South Dallas have more access to healthy food and jobs, but also supplying and taking advantage of the vibrant North Dallas market through farmers markets and supermarkets, CSAs, grow boxes, restaurants, and institutions like SMU, for example, my own. So I gave a special shout out to that school. We built a model that had look at the input components that were necessary, and we slowly, one at a time. How do you eat an elephant? One bite at a time. We started to establish the different systemic components necessary for a healthy agri-system. A seedling farm, a research R&D center that looks and evaluates the process, working with big techs, testing and evaluating different high technology forms, and then working with techs in agri-life, and working also with simple soil solutions that have been there since ancient times. And how do we utilize those to get extra growth? Building and continue to work with community gardens to make them grow better. Our goal is to make Old Dallas grow better. Having horticultural experts in training, where we are still looking for a healthy soil, large and composting system. That's something we would like to still put in. There's lots of land. The problem is not land. The problem is not will. The problem is not the number of volunteers who will come out when they can come out, when they're not busy working. The problem is trained farmers. That is the asset that is most needed if you want to have production in the community. So that's where we really were focusing on this training professional farm. And I have here needed, but actually all these 3 things here now: a franchise farm, a training professional horticulturalist system, and hydro farms are now in place. So these are our current lines of business, each one working towards sustainability. We have a seedling farm that, as I mentioned, puts out seedlings into the community and also staggers our own spin agricultural techniques. We have over 7,000 plant sites at our Hatcher farm, and we rotate those 5 to 6 times a year, putting in new plants. Each one of those plants gets an average of 3 harvests. And so we're really maximizing every square foot. We built these grow boxes during COVID, which are made in South Dallas. And we've distributed those to over 257 homes in North Dallas and over 105 locations in South Dallas, where people are growing using our seeds in their backyards. We now distribute bags of CSAs for 32 weeks a year to 75 households in spring, to 58 households this fall. 40 of those households are in South Dallas. 16 of them are within the Good Life Better program. Excuse me, I'm sorry. And so we are distributing about $70 worth of produce a week to 40 households. That feeds on average 4 people in that household. And we also then teamed up with Love Tito's program and sent our grow boxes to food desert garden programs, utilizing them all over the country. This year, we also opened up a new line of business, which is Grozilla, which is we're testing a entry-level platform for hydroponic growing inside containers, controlled agricultural containers. They're being used in a couple other cities. We went out and found through research what was the most productive and cost-efficient system in the country. And we were able to replicate that and put it into Dallas, and it is now currently running. And we are training people in the community to manage and to see if that's an economically viable system that we can scale. The whole point of our project is everything we try to do is reduce cost, increase access, and make it so that we can have scaled solutions. These are many of our sponsors at different levels and at different aspects of the project. Last year, based on our COVID response with the Grow Box program and also with developing a CSA, we won the American Heart Association Food Innovation Award in our first year of operation. So we're very gratified by that. But we've had many sponsors who have bought onto the results of this idea. The thing I'm most proud of is that all of our corporate sponsors came in with very small grants, and by the return on their investment, they've all actually increased their grants amount in the following year, really because we're able to get such results. And the reason we do is that none of the money goes to anybody in restorative farms except for the people who are growing the food in the community. So we have 5 farm trainees, all from South Dallas, all learning to become professional farmers. And we obviously have Tyrone, who is our farm system manager and head trainer. I show you this picture. This was what restorative farms looked like the morning after the February freeze. As you can see, every single plant in the entire farm is dead. The whole entire system, in fact, all of our system partner farms, we're aggregating 9 farms now, lost everything. But the seedling farm the next day actually planted 7,000 seeds, which was able to jumpstart the entire system again. So I think it's an important model. This is last week. This is what Hatcher looks like at present. You can see Grozilla here. This is once again me and Tyrone at the farm. Here you can see each of these rows maxing out being for staggered growth for weekly production of different products. Last year we did 96 different varieties of products staggered over the 40 weeks of delivery, which is necessary for urban farming. We are obviously utilizing hoop houses, shade covers to extend seasons. Here, what we have here, we put this in one day last week. Literally, this is a week old, which is why you see no plants growing. This is our apprentice farm, over 200 grow boxes, which will be irrigated and daisy chained. And what's really exciting about this project here is that this farm is for the apprentices who graduate our training program to have their own boxes to grow towards the market, which we then buy and supply the CSA. So the CSA, we buy all the products from CSA and we sell those, or we provide subsidized CSAs to the community. All of that revenue goes to pay the farmers for their work. And the farmer in one day can make what they make in farmers markets in 4 weeks, and they make that in 1 hour, so that they can bring 200 products to us. We buy it at bulk, but we give them farmers market prices, and that allows them to focus on what they really want to do and what they do best, which is grow food. And it takes away that burden of the having to be at farmers markets, which are wonderful access points for them to sell. But if they can have that plus an opportunity to sell most of their product at bulk and at that price, it obviously frees their activity up a lot more. So we buy the products from the apprentice farms. They create business plans, and then we're looking for alternative markets for their products. But really, this also gives them a record of work and production and return on investment, so they can go and we can help them find investment so that they can have their own farm that utilizes the same system. So everything we're doing is scalable. Behind here, you see the new hoop house that's built, 3 times the size of our one at the MLK Community Center. So we'll be able to produce about 100 to 120,000 plants that will a year. And to practice spin agriculture, you have to have constant seedling production so that you maximize the square footage. This is more of a plant factory than it is a traditional, what people think of as a farm. Every single square foot is mapped out for an entire year to maximize yields and seasons to increase production to make us more economically viable. So I think that's a pretty decent overview of what we're doing. But our major goal here is not just to provide food, but it's also to create an access point for the community, increase community well-being by growing food within the community at Hatcher Farm, simultaneously creating jobs. And that's the most gratifying part for us, is that as this project is becoming more successful, Doric and myself and some of the other board founders are seeing a point where we can move away and we can leave the farm with those who are becoming the professional farmers from the community to manage and run and have as their own, which is the whole point. So I really appreciate your time, and I look forward to hearing from the rest of the panel some of their excellent solutions. So thank you.
Thank you, Dr. Rincon. We do have some questions which we will follow up as we move forward. Excellent presentation. Thank you so much. Laila Eller-Kresh, you're up. What would you like to share with this group? We've had great presentations so far. There we are. Yep, we can see it. Beautiful.
Great, thanks, Doric. Just put myself in presentation mode here.
See carrots.
Okay, there we go. Thanks, Doric. So I want to thank the Dallas Coalition for Hunger Solutions for putting on a great virtual summit over the past few weeks and for inviting me to speak on some of our COVID-19 food access initiatives that were launched last year. So before we started executing programs, we had to understand, what was the scale of the problem? Were the areas that were being hit hardest by the pandemic, according to testing data, were they the same areas where food access was an ongoing need? And near the onset of COVID, the Office of Innovation actually conducted a shopping for groceries survey, which is essentially helping us better understand the need for food access during this time. So working with city partners and external organizations, elected officials, we put together a short public survey, and thanks to promotion by our elected officials, cities, external organizations like the Dallas Coalition, we received over 2,500 responses across every zip code in the city but one. Some of the highlights from the data showed that we had disparities in food access and behavior when comparing with zip codes that had the highest levels of impact from COVID and the city as a whole. So for example, individuals living with high impacted COVID areas or in those areas were more likely to rely on driving to access food. That was 87% for high impact COVID areas versus 75% for all respondents. They were more likely to state that they sometimes or often cannot afford to eat balanced meals, and they had to make less healthy options due to cost than the city as a whole. So using this data, and the survey was conducted last spring, so in the very early part of COVID in the public health crisis, we developed a few programs, and today I'm going to speak to 2 of the programs that were well received by clients. In both cases, we wanted to address at least one barrier to food access using human-centered design principles. If you're not familiar with HCD or human-centered design, it simply puts the end user or the customer at the heart of designing and executing programs. If you're interested in actually accessing this dashboard, I'm happy to put a link down below. All of the information is available by zip code and available for anyone to access and analyze in their own time.
Yes, please share that link. That's awesome.
Great. So our first initiative was the Safer at Home food recovery boxes. So we heard from respondents that transportation was a challenge in purchasing food, even before the pandemic. So at the time, what we knew about COVID, if you'd been exposed to the virus, the recommended quarantine period was 2 weeks. So you can imagine for someone who lived alone, who was older, who didn't possess transportation, accessing food for that time may have become a challenge. Many clients didn't want to go to the grocery stores after receiving a diagnosis, or by contrast, they were willing to go to work because they needed the paycheck to pay for those bills, like buying food. So this program aimed to address some of those needs by creating a temporary delivery service that would bring a 2-week supply of food using contactless delivery. So there were 2 critical parts to this program because we were building from scratch. One was the assembly and the delivery of the food boxes themselves. And of course, our aim was to provide a healthy mix of products in the food boxes with some, staples from your pantry. And 2 was creating an easy digital experience for those who needed to access the program so they could use it on their mobile device if they did not have home internet. And we also established a dedicated email address for inquiries. So on the screen, what you're seeing is actually an early mock-up of the site. Essentially, you could order a box in 3 clicks just by filling out a few boxes with your address. We worked with a fabulous partner in setting up and designing the site, translating it to Spanish so we could serve non-English speakers, and the partner continued to support the program as it evolved. So we also ran a pilot pre-launch, which gave us great data points, and we used that feedback to strengthen the user experience when we officially launched the program. And just to give you an idea of the impact, just between Thanksgiving and New Year's alone, last year, the program provided almost 900 food kits to households, and approximately 1,800 food kits were distributed to residents over the lifetime of their program.
Oh.
And below on the right is some of the feedback that we've been getting based on our feedback from the surveys. Initiative 2, because I know we're on a tight 10-minute program overview here. Our second initiative was we launched our in-home garden kit program. And the question we were trying to launch here was how might we increase fresh produce supplies for families? So we knew that the Safer at Home food recovery box program was a one-time intervention, and that some families would continue to lack access to produce and may work in fields that were vulnerable to COVID exposure. So we also saw in the food and grocery survey that 1/3 of respondents traveled farther than their closest grocery store because they were seeking a better selection of fresh fruits and vegetables. So in assessing the marketplace, we believe there was a way to address the seasonality of the growing season by bringing gardens indoors and essentially creating a type of hyperlocal gardening community for individual families. So on this screen on the left, you can see a sample of the garden kit, and the box represents plant pods or seeds on the left. And on the right there is an example of an actual garden from one of our recipients. So they sent in a photo. The garden kits included a mix of different types of lettuce mixes, basil, and tomatoes. So we partnered with a vendor to deliver these countertop in-home gardens. These gardens are designed to grow food at a faster pace than normal soil-based gardens. They're not dependent on natural light, and they use very little soil or water. Recipients in the program had a recurring supply of produce for 6 months. They were shipped via contactless delivery. And during the course of that 6-month period, we reached out to recipients 3 times to assess their usage and satisfaction with the program. Based on the feedback surveys, we heard from recipients that the top benefits of growing food for themselves were direct food access, eating more nutritious meals, having an ongoing supply of produce, learning a new skill, helping with mental wellness, and spending less on more expensive grocery items like fresh produce. Over the course of the 6-week period, over 80% had used their home produce in meals like salads, basil and tomatoes on pizza and soup, making pesto, marinara sauce, and also using lettuce in items like for meals like burgers and sandwiches, lettuce tacos, etc. And our other element of the program that we were very fixated on is making sure that the product itself was very easy to use, assemble, and maintain. And through a feedback survey again, we heard that more than 90% said the garden kit was easy or very easy to set up. So here again, I wanted to just embed in some photos that we received from recipients. So you can see on the top right photo how the seeds grow out. So you pop in a plant pod, it starts blooming, and then you can see on the left how the basils continue to grow there, and then you can see some of the product of the lettuce. So it is a substantial amount of food for a family that they can grow and have regular, let's say, salads on a weekly basis. So just to highlight some of the successes and lessons we learned, because we had a very short period to expend our COVID CARES Act funding, and that's what funded these two programs itself. So we started our efforts by asking constituents, what they needed, where were they struggling, and we stayed connected through follow-ups. So we really centered users. So we didn't provide a service and disconnect with them. We really wanted to understand if the programs we designed served the core objective, and we wanted to use that feedback to improve the program. So for example, for the Safer at Home food recovery boxes, we learned that we needed to add 1 or 2 additional items for clients to feel a sufficient amount of food was supplied. We also saw that 90% of the participants were very satisfied or satisfied with the service. So that continuous stream of engagement was really important because we wanted to know for the users, was the order received? Was there someone who cared about their ability to access help and make sure that they got the help they needed? And again, especially in those early days of COVID, it was a very stressful time, and we wanted to alleviate the burden of food from those who needed it. And we know that many community organizations, probably here on this call and others, were aligned to the same mission, but addressing it in different ways. The second successful lesson learned was that, partnering with community organizations, health organizations were really critical. They helped us identify clients that the city itself might not have been aware of. And again, we wanted to make sure that we were addressing the needs of clients who weren't being served in other ways so we could maximize the impact across as many people as possible. And third, we wanted to make sure we were building on what exists. So given the urgency and the timeline for us to spend the money, designing very effective programs in a short amount of time, we wanted to lean into existing experts and build on what already exists. So for example, we knew there were companies out there that had extra capacity or who had reached out to us and wanting to assist in the delivery of food boxes themselves. They had the expertise, they had the supply chain. And by tapping into those existing organizations, the city did not need to recreate its own supply chain. And so those were some of the core lessons we learned in terms of designing core programs that were very time-bound and essential for our clients.
Fascinating. And it looks like there is some overlap potentially with the restorative farms effort with the grow boxes and things like that, which they did during COVID as well, to get people growing on their own property. So that's fascinating. I really
absolutely. And we have heard for both of these programs that people are interested in finding a way to continue to expand and scale those programs and reaching out and learning more about other organizations like restorative farms where they can be an additional partner in this effort is something that will help, more and more Dallas residents, access fresh food and produce.
So this is still an active program or programs?
This program was funded through the CARES Act funding, and so we're looking at potentially through new funding approved by Congress earlier this year, the ARPA funds, American Rescue Act. What are ways that we could improve the program and relaunch it?
Beautiful. Thank you. That was fascinating. Very much. Thank you very much, Laila. Good to see you again. So, without further ado, Ashley Douglas is going to share a little bit of her world with us.
Thank you so much, Dr. Earl, and thank you to DCHS for the opportunity today to talk a little bit about Southern Dallas Thrives. I will not provide you all with any slides. Dr. Earl spoke so highly of our website, which provides a lot of information, but I just wanted to kind of talk to you all a little bit about some of our work, who we are, and what we've been able to accomplish over the very short time of our existence in the last 3 years. So Southern Dallas Thrives is a collaborative effort that was founded with United Way of Metropolitan Dallas, PepsiCo Foundation, and Frito-Lay North America. And the goal there was to really advance long-term sustainable economic mobility for our residents, specifically throughout the Southern sector. And when we talk about the Southern sector, we talk about South Dallas proper as a Dallas native, a Southern Dallas native, I must say. When we're talking about Southern Dallas Thrives, we're talking about Southern Dallas consisting of Oak Cliff, South Dallas proper, and Pleasant Grove, parts of Pleasant Grove over in the Southeast Dallas area. Our goals are very aligned with what we are working on at United Way in the areas of education, income, and health, really focusing on a partnership that aims to really advance outcomes for our students pre-K through K-12, reduce food insecurity and increase food access for our neighbors in the Southern sector, and support our women from Southern Dallas as they both enter and advance in the workforce. The goal overall is to connect our students, women, and their families holistically with programs and resources that will help to really improve education, provide career pathway options to financial success and economic stability, and overall, holistically, the tools to live really active, nourished, and healthy lives. So a little bit about some of our work as it relates to, what we've been able to do. And we oftentimes get asked, why Southern Dallas? We know that unfortunately, Southern Dallas has become very much so trendy and buzzword worthy. But my goal and our goal with Southern Dallas is really to remain committed to driving some lasting long-term change throughout the Southern sector. And we're doing so with partnering with several grassroots organizations located actually within the Southern sector, but also primarily serving residents and neighbors in the Southern sector to address some of the major concerns that we see in the sector. So we oftentimes get asked, why Southern Dallas? On average, we're looking at around 91% of our students who are classified as economically disadvantaged. We know that fewer resources are available to residents in comparison to our northern counterparts. Also, the Southern sector is comprised of 49% of the tax base, and communities within this area have traditionally been under-resourced, underserviced, and lack opportunities for success intentionally through areas of lack of opportunity for success in that area. So really holistically, Southern Dallas Thrives looks at a model that really works to provide a collaborative opportunity with corporations, the philanthropic community, nonprofit community, as well as leaders and community residents throughout the sector to really bring together a collaborative model of how we work effectively to identify needs within the sector and work with those who are on the ground and our residents who are experiencing many of these plights daily on how we most effectively approach and work to address them. And so Southern Dallas Thrives has three primary focus areas that I mentioned a little bit earlier, aligned with education, income, and health pillars at United Way of Metropolitan Dallas. Of course, the first one in the health arena would be food access. We really want to increase the access to healthy food and meals throughout Southern Dallas by really working with many of our grassroots entities and organizations to figure out how we most effectively increase the capacity of individuals that they're able to serve. In the education pillar, we're working to support students both in pre-K or our early childhood scholars with working with childcare centers throughout Southern Dallas to really increase their capacity through providing training opportunities that really allow them to increase the number of skills sets that our educators and administrators in that early childhood space have access to, really focusing on quality improvement there so that our childcare centers have the opportunity to increase their capacity and the number of folks that they're able to serve. And also providing that as a wraparound resource to participants in other parts of the initiative as well. Also working with high school students. We primarily started at South Oak Cliff High School. Our work has expanded now to Lincoln High School in South Dallas, as well as Roosevelt and Oak Cliff as well. And the goal there oftentimes is really to increase the academic high school graduation rates. For example, when we started working with South Oak Cliff High School, we saw about an 87% on average graduation rate from high school students there, which sounds okay, but in comparison to several of our northern counterparts, for example, Woodrow Wilson High School, who at the time was graduating 97% of their student bodies, we saw a huge area of discrepancy there. And so in the academic arena with our high schools, absolutely, that is a primary concern, but we're also working to figure out how we most effectively expose our students to career pathway opportunities post-high school. We know oftentimes, college readiness is a huge piece of the work that's pushed. But we also have to look at, opportunities for our families and students who may be ready or be required to enter the workforce upon completion or high school graduation. And what does that look like? And so this past summer, we've been able to provide some paid internships. In the last actual 4 summers, we've been able to provide paid internships with many of our corporate partners for the initiatives for high school students in Dallas ISD, specifically in the Southern sector, which our goal there is to hopefully create a workforce pipeline through that career exposure opportunities, apprenticeships, and internship opportunities. Lastly, a newer part of our work is really expanding workforce development opportunities for women in the Southern sector. And the goal there is really to, we have a target of 200 women that we want to work to increase opportunities to either enter and or progress in fields that are, one, predominantly male-dominated fields like pathways of construction, mechatronics, logistics, and things of that sort. But then 2, also be able to provide wraparound supportive services like career coaching and also access to household basic needs. Food access is a big piece of that, and we work with our partners over at City Square to be able to help with that, as well as on the corporate side, working with Food for Good under PepsiCo to be able to do that, and a plethora of other partners throughout the sector. And also areas where we're, partnering with local municipalities, the city of Dallas, to be able to provide assistance in the areas of childcare, so that folks are, have opportunity to, focus on job training and workforce development while not being burdened with the costs associated with putting their children in childcare. So that's a little bit about our work. During 2020, we absolutely saw many of our efforts pivot as a result of the COVID-19 pandemic and really addressing some of the associated needs there. We had the very fortunate opportunity of really collaborating with so many of our small nonprofit organizations, grassroots organizations. I see some of them in the chats today, like your 4 Oak Cliffs and Cornerstone Baptist Church and, I Look Like Love and several other small organizations and nonprofits who are on the ground every day doing work with our residents. And so what we saw there is being able to infuse some dollars into providing some emergency assistance throughout that year. More than $300,000 we were able to provide specifically to those small nonprofit organizations. We were able to effectively impact more than 430 students, really laying the groundwork for ongoing educational and post-high school success, as well as impacting more than 7,000 neighbors throughout the sector through receiving the resources necessary for them to live longer, healthier lives. So that is a little bit about Southern Dallas Thrives and our work. Dr. Earl mentioned our website, and it is that you can kind of go and see a little bit more in-depth information about some of the work we've been privileged to do. UnitedWayDallas.org/Southern Dallas Thrives is where you'll find that, and dive a little bit deeper into each one of these pillar areas. We're so excited for the opportunity to collaborate with the other panelists today and talk a little bit more about accessing food specifically in the sector that we know is comprised of our residents who don't, lack the abilities that we oftentimes talk about. I think one of the panelists mentioned earlier, hinging on many of the strengths of our neighbors and residents alike in the Southern sector. And that's kind of what we like to do and really walk alongside them in the process of figuring out how we most effectively address the needs.
Sounds like you don't have a very busy life at all, nothing going on. My goodness sakes. Well, that's the beauty of this panel. And I think the intent is to keep gluing together the collaborations, gluing together these great efforts so that eventually we break through and resolve the issue. So I'm really thankful for your efforts, and I expect us all to work together going forward. Thank you so much, Ashley, for sharing. And next, our esteemed Pastor Darrell Carter is going to share a little bit of insight in his good work in Southern Dallas with his Carver Heights Baptist Church and tending his flock, herding the cats, and all the other things that he does as a great shepherd and steward for the Lord.
All right, we want to thank you for inviting me to this panel. First time being a part of a panel such as this, but I want to say thank you, and I appreciate this opportunity. But here at Carver Heights Baptist Church, you know, I like to say this is where the rubber meets the road. I heard earlier he mentioned the 75216 zip code as being one of the worst for hunger and food, and that's the area that we serve in. Some 17 years ago, I became pastor of Carver Heights, and I say the last 15 years we have been working with North Texas, and now we're with Crossroads, and our goal has been to feed the community where we serve. We got a group of volunteers here at the church, and man, we've been giving out millions of pounds of food a year here at the church. And you know, we've done it in the last 15 years, mostly without any help, you know, funds from any other organization, but we've been able to do it. And what we do here is, since the pandemic, well, before the pandemic, we actually had like a grocery store where the people could come in and they could shop inside of our food pantry, you know, get their carts, go up 2 aisles and just get, you know, all of the things that they would need and they would want. Before, we were giving them what we wanted, but now they get what they want to get. That was before the pandemic, but after the pandemic came, we had to go back to filling the boxes of nutritional type foods. And, you know, and even in the midst of the pandemic, back in February during the freeze, over 85% of our church was flooded. And I guess the good thing about it is was that, you know, we kept going. We never stopped. We kept giving out the food. Even in our food pantry, there was a flood. And we cleaned it up and we tended to that first, and we kept the food rolling. But we service about 250 households a week. They can come and they can get the food 2 days a week. And, you know, we at our church, Meals on Wheels operate all of the elderly who are in our community. Meals on Wheels, you know, they come here for the food and they go out and they serve those. All of the kids that are on probation in our community, they meet here twice or 3 days a week. That was before the pandemic, and they're still doing some things here. And, you know, we're just trying to keep things viable, keep food moving, keep the people that don't have little of, you know, they can always come to Carver Heights. And even through North Texas Food Bank, they have made a way for us to go to 5 Walmarts. We purchased a box truck and we go to 5 Walmarts Monday, Wednesday, Friday. They give us food out of the back door, you know, through Walmart, and we bring it back. And most of it, some things we may have to throw away, but, you know, for the most part, there are some good things that we could put in our boxes and share with the people of our community. But that's what we are here for at Carver Heights. We're at the, you know, where the rubber meets the road. We're here to help the people and to give as much as possible. And we're trying to partner. We partner with Dallas County Older Adult Program, where our older adults in the community could come. And before the pandemic, they could actually come here and meet and do all types of activities and get food, the lunch, and they could get a breakfast. And now, even though the center is closed, it's really not closed because they can still come here on a daily basis and they can receive the food from the Dallas County Older Adult Program. And the people are still coming, and they're in need, and this community needs it. And we're working with Dallas County, and hopefully with Juanella and Mark Edwards, we can be a part of that, of the community garden program. We want to set up a community garden here at our church, and so that we can just be a viable part of our community. That's what we're here to do, to serve the community. And I think that's just about it. Next time I'll be more prepared, because now I know what it's all about. Thank you.
Well, thank you. And it sounds like you're doing great work. And I think there are opportunities on this panel for us to collaborate and teach and learn and share the resources, share the knowledge, and expand the collaboration so we all reach more of our constituents and help more people as soon as we can. And as the Bible says, one hand, we want to give people a fish if they're really hungry, but at the end of the day, we really want to teach them how to fish and build the ponds and grow the rivers and streams so that we never worry about food again. So I really appreciate what you've done and what you're doing, and I think there's a untapped collaboration here in this panel.
Thank you.
Thank you, Pastor Carter, excuse me. And Alexis Baker, last but not least, who's got a fascinating job at City Square as the food recovery manager. Why don't you share with us a little bit about what your day looks like?
Sure, I'd love to. Thank you. I'm actually going to try to share my screen here. A few slides. All right. So, thank you so much. And I'm so amazed by all of the previous panelists' presentations. I'm just wowed by all the different initiatives that everyone is taking part in. And I hope that after this, we can even collaborate more. I appreciate the introduction that you all gave for me previously. And I kind of want to just mention that because of my 9 years plus experience in the food industry, I have witnessed a lot of food waste, and that has kind of led me to this job that I have now as a poverty fighter at City Square. Essentially, I was brought on in 2019 to pilot and implement a new food recovery meal program. So I briefly wanted to touch on City Square as a whole. For 30 plus years, City Square has been working to fight poverty through service, advocacy, and friendship. So we kind of focus on 4 different pillars here: hunger, health, housing, and hope. And I kind of wanted to shout out a few of those programs. Our first and foremost, like our food pantry, currently operates as a drive-through model and is serving neighbors in need Tuesday through Friday. We also service housing needs as well with on-site cottages. And another organization that another program we have is our Drop-in Youth Center track, where our kids aging out of foster care can actually drop into this youth center, get one of our food recovery meals and any other services they may need. So we are located off of Malcolm X Boulevard, very close to Deep Ellum and the Texas State Fair. I kind of wanted to showcase our 2 beautiful kitchens here. So we've got a big production kitchen with all of the equipment that you would ever need to produce meals on a large scale, such as like a tilt skillet and convection ovens and such like that. And then on the bottom left here is our cold prep space. So we do all of our packaging here as well. I wanted to highlight my all-star team here and note that this program is supported by one other staff member, Wesley Maynard, who's on the left here, as well as AmeriCorps and 8 ERP members. We've also used volunteers in the past to support the program as well. But to highlight AmeriCorps and AARP, we bring these participants on as a learning opportunity to both get hands-on experience in the kitchen, as well as like network and developing type opportunities. So I'm thankful to have them. Our food pantry receives a wide variety. Honestly, I'm amazed by some of the stuff that we receive. I actually was down in the pantry today and I saw like leg of lamb. Like I'm just amazed. But so We take in a large variety of fresh produce from North Texas Food Bank, which goes directly into these meals. And then from there, we also work with retail partners and hotels and restaurants to kind of take in excess food. For example, like prepared foods from hotels. Instead of that food going to waste, there are hotels that will just give me a call. We go and pick up. And if the food was cooled down safely, we can actually bring that into our facility, package, label, and send it out to those in need. So I kind of want to go through the process of it all. So first, obviously, is production. Currently, we are producing about 200 to 250 healthy meals a day. All of our meals are 1 pound packages, so 250 pounds, 250 meals. We produce these meals 5 days a week. And every single meal that we do meets specific health guidelines that we have set. So every meal that any community center receives from us is going to contain at least 75% of healthy ingredients. And we define that as lean meats, frozen or fresh fruits and vegetables, no sugar added dairy, items such as that. One thing I want to mention about this program that is amazing and is an opportunity that I've never experienced before is that we have such a unique menu. We don't make the same thing twice because everything is based on donations. Our week is fun to put that in perspective. So we could make a shepherd's pie one day and the next day we could be roasting a leg of lamb, or we may get a call from a local hotel that has an excess of prepared food from a banquet. And that day, okay, I guess we're packaging up banquet food. So it creates a very interesting dynamic in the kitchen that I've never experienced before.
Kind of the Iron Chef of
yes,
beautiful.
Yes. So our packaging, I want to kind of shout out that we are intentional with the type of packaging we use. We have biodegradable trays. So kind of creating a full circle program, even our trays and packaging can go straight into compost. We offer convenient heating instructions. So all these meals can be heated either in the microwave or the oven. And each meal contains a detailed list of all the ingredients, best by date, use by date, allergens, everything you would need to know to just heat that item up at your facility. So the next step after we've produced and packaged, now we're at the community pickup. So the way it works now is that every Wednesday, community centers will get a detailed menu list from me of everything we produced the previous week. And then they can set whatever type of pickup arrangements that they'd like. So we make this very convenient for our community centers. Each community center pays a very small handling fee per meal. And that just helps us support operational costs and packaging. And then we also make this very easy, and we have a cooler swap system. So we pack your items in a cooler, and then when you come to pick up, we load your truck or van or whatever up, and then you bring me back the previous coolers from your previous pickup. So that's really exciting. We have some partners down here like Soupmobile, the Stew Pot, and the West Dallas Multipurpose Center picking up some of their meals. So we have goals to not only support external partners, but our internal partners as well. So that track center that I mentioned earlier, we provide meals to them so that kids can come in and get something that's very home cooked, healthy, delicious, while they're also receiving other services. Of course, our food pantry also has access to these meals. And most recently, we actually have been providing meals to our financial and workforce readiness programs. So students that are coming on site to get additional financial support and stuff like that can also receive one of these meals. So trying to make this a well-rounded thing. We're getting in, recovered food, and then we're making sure that our programs are supported by that food. Here's a shout out of some of our external partners. So Youth with Faces, we're thankful for all of these partners. When we first started, most of our food was going directly into the food pantry. And since, about 2.5 years now of experience doing this, we've kind of built this network of other external sites that I'm super grateful for. And I hope that maybe some will also generate after this call.
Yes, we need to fill up that board. Absolutely.
Yes, yes, I agree. So to touch on some of our programs, goals and outcomes, obviously the first and foremost is to reduce food waste, but that providing on-job training is also very huge and near dear to my heart. I want to allow anyone that comes into my program, AmeriCorps or AARP, to be able to feel confident to go and get another kitchen job after they've served their term with me. I think that's very important. And we give them a very unique experience in that they are able to prep, package, learn how to make a label, all the above to do what they need to do. We also ensure that our partners and individuals that we serve, our neighbors, are satisfied with the service that we're providing through surveys. So you'll receive ongoing feedback from me and vice versa. So what the program is looking like now, we are transitioning out of the pilot phase. Actually, we've already transitioned. We're full on going for it right now. So what we're looking for now is more community partners that are in need of these ready to heat, healthy meals. And then also actively searching for a lot more prepared food donations. When the pandemic hit, well, before the pandemic hit, we actually were able to partner with a local hotel, and we were seeing an incredible amount of food a week that we were able to divert. And I kind of have seen a decrease in that because of the pandemic, but I know that there is food waste out there, and it's just a matter of trying to connect all the dots and get that food to us so we can get it to those who actually need it. And then organics composting as well. So we recently have transitioned our waste service to a recycling, organic, and trash, like co-mingle type thing. So not only are we receiving and recovered food, but we're making sure even the scraps that from our food is also going right back into the cycle.
Excellent.
So all in all, this program is just trying to bridge that gap between food waste and hunger. To hear, stats like 40% of our nation's edible food ends up in landfills just blows my mind, because there are ways that we can all work together to really fix this problem. And I think this pilot program, this new program, is one of those ways. So continuing to be open to conversations like this, I think will get us where we need to be.
Absolutely. And you want to see a wonderful visual depiction, go out to NBC5 and look up Ashley. There's a great video, short video of her doing her work, making her magic, cooking your food. I think it's a fascinating little peek into what goes on in your kitchen.
Thank you.
So thank you so much. We're about have another half an hour, I think, left scheduled. There's some questions that have queued up that didn't get answered before I go to the questions I've created already. If you don't mind, for all of the panelists, I'm going to go to the Q&A bucket and see who haven't. Dr. Lynch answered a bunch, but there are still a couple of open ones. This is Valerie Hawthorne has a couple of questions for Dr. Rincon. Here, I'll read them to you. Curious, why do your studies exclude Cash Saver and Fiesta supermarkets? Better way to ask is mainstream. No, better way to ask is what is mainstream in your study? Thanks. And question 2, follow-up, is the presence of Cash Savers, Fiesta, et cetera, markets harming neighborhoods and keeping mainstream markets from coming into the area?
Well, that sounds like two questions there. One, our studies in the past have included all food service providers. When we do a study of market demand or the retail demand for food providers, we try to include all the major supermarkets. And to some extent, if we want to know where people are shopping, so that would include dollar stores and other places too. So we don't exclude, we want to explain all the shopping experiences that people go through. Mm-hmm. And yes, the dollar stores, there's plenty of research that shows that the growth of dollar stores is what's happening in many of the food desert communities, because mainstream supermarkets in large part ignore them and don't see profitability. The dollar stores are increasing across the nation, not just here locally. And to their credit, the city of Fort Worth actually not too long ago created some zoning limits to control the growth of dollar stores in that city. So that was a pretty bold step. And I would hope that the city of Dallas would also consider something along those lines. But again, without a market demand study, like I mentioned in my previous presentation, Without a market demand study to define what people really want in this community, in South Dallas in particular, it'll be a guessing game, and we'll be constantly throwing solutions at them. But at some point, just like every supermarket does, you need to do a market demand study. And we're currently seeking funding for such a study. We've already sent proposals out to a couple of organizations, but we all have our ideas about what solutions could be. But everybody stops, every company that I know of in the retail business stops at some point to do a survey of the target audience, a good survey, not just an online survey. You want to reach all the people, so just doing an online survey isn't going to cut it, because you're leaving out a lot of people that don't have access or don't feel comfortable doing online surveys. We've done surveys in multicultural communities in 5 languages for many years, so we know how to get to the real truth of what are needed, what things are needed in these communities.
Good. I appreciate that. And one thing too, I think there's a lot of interest from all of our viewers, so to speak, and in sharing your email address or official email address. We may ask you to do that. A lot of people are interested in following up and partnering with all of you here. So we should.
To that point, I might add that I will be sharing a PDF version of my PowerPoint slides. There were 2 slides that we didn't get to because of the glitch I experienced, but in those 2 slides, I have a number of research studies that I have links to, as well as a urban site selection website and my own email address. So I will be posting. I don't know the best way to share that information. I can post it on my website, or the symposium sponsors can send it to everybody. But yes, I'm more than willing to share the information from my presentation to anybody who desires it.
Yeah, I think we're going to follow up with an email. This is being recorded. I think Laila and company will be sharing an email. So if everybody's comfortable sharing their email, I think in the follow-up, we'll be able to do that.
Good.
Any other commentary? Let's see if there's any other questions that, Owen, I've seen you've answered a bunch. Let's see what else. That's about it on the open questions. Let me go to, unless I've missed one. Let me go to the questions we prepared. First one for you, Dr. Lynch. And I think for everybody, after you take a stab at it, what are the major barriers that are causing this food insecurity to continue from your perspective, Dr. Lynch? And you're gonna have to come off mute unless you want us to read your lips.
My lips are so numb right now, I don't think that it's possible. But I think COVID laid bare some of these barriers that we have. Much of the not just the city of Dallas's food, but actually the entire Southwest region's food comes into the South Dallas warehouses, over 48 of them, and then gets packaged and then redistributed out to the rest of the country. Ironically, very few of it, or very little of it, is going into the community at affordable prices or into stores like Andrew Sanders has been trying to set up for a long period of time, community-based grocery stores where there is a market for it. And I think Ed's work can demonstrate that. So we have to start building markets, but to build markets, you both have to have the supply and the demand. And you have to kind of bring both of these together along. And I think the demand is there in the Dallas market as a whole for fresh nutritional food. We're way behind in being able to produce that food at scale and reliably to fit the market demand, so that when a customer orders food, that they know that we deliver it exactly what they want, and we have enough redundancy in the system to do that. So from my end, what makes it difficult is there's a large amount of investment that has to go in, balancing different innovative models of growing and the infrastructure in order to do that. We're starting to get that built up to get critical mass that people can add their farms on, and then we can start really aggregating and seeing if we can start having a local solution. So it's taking time. Other cities have had a more robust investment plan to invest in local solutions that primarily funnel money and buy from local producers, and also support farms that hire and train people in communities where they don't have access to a lot of food. And so that would, or jobs. So that's something that we try to do at Restorative, is we try to buy as locally in South Dallas as possible so that we get that multiplier effect of our own investment. And we try to make sure that all revenue gets reinvested back into the system. There's been a large amount of money invested in through initiatives that then leaves the community right back out. It's called the leaky bucket theory of nonprofit. So we're trying to do the opposite. We're trying to have a bucket that gets filled up and pour over. And really, I think that people have to, everyone, it means a multi-level solution. We need the food recovery solution desperately. We need the local boots on the ground solution as well. So I think that people working together, recognizing everyone has a place, and know your place, and work well with others in that area. And I think that's what's going to get what was needed. COVID has really made the scale of this need visible to all.
Yeah, absolutely. Ashley, you were nodding in concurrence. What do you see as barriers?
I actually think Owen covered quite a bit of them. I think that, a big part of it as well is, the lack of inclusion of community members and residents, right? And so oftentimes, you see individuals who are not privy to the life, the foodways, opportunities that are available in a sector, and oftentimes kind of drown out or not include voices of community, which is such a critical part of food access work in general, and really necessary, I think, to move any pendulum forward as it relates to addressing needs. And so that's, I think, one critical piece to take into consideration as well.
Yep, I agree with you. I think that this collaboration, I think we have a tendency to get heads down and build our little silo, and don't necessarily, because we're working so hard, see peripherally all of the partners that we could potentially connect with. And I think this is an example of ideally where we continue this partnership after this conversation. So Ed, from your research perspective, what systemic solutions or potential systemic solutions do you think would work in North Texas community?
Well, two things. One, public policy. I think in the previous summit, were the two authors of the, I forgot the name of the book, but it talks about poverty. And it was a very compelling discussion. But one of the main conclusions that was drawn from there was that it's not the poor people, it's not the people in poverty, it's the public policies that are made regarding people that to some extent keeps them in a state of poverty. And what's happening, how that translates to the food area and the food deprivation issues is that we would never tolerate new companies coming in here and refusing to do business with certain segments of our population. Why do we tolerate that with supermarket chains? No, there's no logic as to why they just choose to pick whatever spots they want to, and the city just turns a deaf ear. In fact, in some cases, provides them tax incentives to bring new stores into these communities, while at the same time completely ignoring the fact that one community might have 7 existing supermarkets already. They don't really need another store in that community. Right. And on the other side of town, on the south side of town, most of these communities don't have a supermarket. They might have one, but for the most part, they have access to lower quality choices. Right. So systemically, I think that we're not going to get to the point of regulating supermarkets like banks. Banks are regulated by the federal government against mortgage and then housing redlining practices. But I think our community needs to shift some attention to pressuring these supermarket chains, and not necessarily give them all the tax incentives they want, but be able to get them to the table I noticed there's no one on this panel from a supermarket. And I've presented the results of my research in several presentations to community. I've never seen a supermarket representative present. I don't think they want to talk to us. I think they just don't want to deal with the realities of these redlining practices. But I think to the extent that the media people also begin to cover these issues, instead of celebrating all the news stories that are coming into the North Dallas area all the time, I think the media people, especially newspapers and television stations, they need to focus their cameras on the fact that redlining practices have persisted in our communities for many years. It's time to change.
Good. Anyone else have a strong feeling about that? What other systemic solutions? I think you're right. I think the advocacy part has to be part of the effort. You can do the implementation, you can provide services, but if you're not advocating to change the equilibrium that's caused this to exist, if you're not changing that, you're not going to get a full solution, I don't think. So good. I appreciate your commentary.
Thank you.
Laila, how are you? Are there solutions already in place in other communities from your perspective that could be implemented here?
Sure, thanks, Doric. So first of all, I want to say just part of innovation's role is not necessarily to start from scratch, but to build and improve upon a solution that may already exist and to implement in a way that is locally appropriate and culturally competent. So we're always evaluating the national landscape to see how other cities and organizations are addressing systemic challenges like hunger and food access and all of the supporting industries and sectors that create an equitable food ecosystem. So some of the initiatives I wanted to share out to the group. The first one is called Healthy Bodegas. This is an initiative out of New York, and it is an initiative that connects small farmers to bodega owners in food desert zip codes and census tracts. And so traditionally, bodegas are corner stores that have, less perishable items. If you think about a bodega or a corner store, they have like your traditional, soda and maybe unhealthy food choices. I think back in the day, phone cards, lottery tickets, that type of thing. Yeah. And so they've shied away from stocking kind of these less perishable items. And so this initiative actually connects community asset that already exists in corner stores and allows, business owners to expand their profit pool. And a similar initiative out of Minneapolis, actually, their pilot out of 10 programs with corner stores delivered almost 150% increase in this product categories through some supportive work in how to market, how to take care of perishable items. And that actually led to a policy change, to Dr. Rincon's last point, where they now require a certain minimum product mix to be perishable items. So that's one initiative I wanted to raise up. The second one is just creating, again, using existing assets. For instance, we could use our bus stops and rail stations to do pop-up farmers markets. There was a pilot out in Atlanta, Georgia that used a specific station as part of a pilot. That station was located in an area where 50% of residents lived below the poverty line. So one day a week, their market offered fresh produce, 2-for-1 SNAP purchases, cooking demos. There was a bike tour of nearby urban farms, and they even consulted about enrolling people in food assistance programs. And so the goal of that pilot was to expand out to all of the rail stations in the future if it was successful.
That's it. Yeah. That comment, because the restorative farms the first one was based on DART property, Dallas Area Rapid Transit, and they have dozens more properties that they're thinking about trying to figure out how to take this template that Owen's organization has put together and see if we can expand it throughout their network. So that's a very interesting prospect you said that was in Atlanta?
That was in Atlanta through MARTA, which is their public transit authority there. And then just two more I want to quickly touch upon, because again, we're talking about food access. There's an initiative out of Baltimore connected with their public health department. It's called the Virtual Supermarket Program, Balti Market. It's a public-private partnership between the public health department and a major grocery chain. And essentially what it does is the program uses the grocery chain's online grocery ordering service and delivery platform, and it brings food into neighborhoods that have inadequate access to food today. And so the role of the healthcare department or the health department rather, is to train residents on how do you order food for seniors who are disabled, people who live in public housing, And essentially you can order them and get them delivered to community site for no delivery cost at all. And so it was the first community-based program nationally that actually used kind of this online ordering platform and partnership model, and it accepted SNAP. Payments could also be made through money, cash, credit, or debit as well. And so that was an interesting model that, again, you're using an existing resource, you're using partnerships to expand out food access for people. And that's called the multi-market virtual supermarket program. And finally, I'm sorry, there's so many examples. I want to just mention AgriHood, if you guys aren't familiar. It's this concept of mixing in development projects and dedicating part of the development land to a farm. So it's a much more agile, community-driven approach to addressing public health concern. But the example that I'll pop in the chat box is out of Santa Clara. This is in California, less than a month ago. They are building out an affordable housing project there. So out of 360 units, over half will be dedicated towards senior housing and veterans who are in need of affordable housing. And they dedicated an acre and a half of land on that property, which will produce about 20,000 pounds of food per year, which will be highly discounted for residents in that community. And we're seeing this kind of model expand out when people are thinking about, how do we feed people in agriculture? And if we can't attract grocery stores, what are other ways that we could increase food access? So sorry for the wrong answers, or for the long answer in the multiple examples, but I wanted to just pop those examples in for the attendees and pique their interest a little bit about innovations going around the country.
No, that's why we're here. That's excellent. I very much appreciate that, Laila. Anybody else have some thought on things that have worked elsewhere that we might co-opt for our little slice of heaven here in North Texas?
One thing I forgot, I'm sorry, just one last item, and I'll be very brief. There is a real innovative solution, a private-public partnership in Indiana. And what happened is a high-tech firm that manufactures micro devices, that they were going to set up a new plant in Indiana. And it just happened that there was a food desert there, predominantly African-American residents. They had to walk like 4 or 5 miles to the nearest supermarket. What they decided to do is to set up a supermarket, a grocery store supermarket, and in addition to the plant that they were establishing. In addition to that, they identified 2 young African-American males that were already running a convenience store nearby as a temporary effort. They hired them and trained them in supermarket strategy, merchandising techniques, and they're going to be running that store, and eventually they may become part owners of that store as well. Anyway, I thought it was a really innovative private-public partnership. I don't know of any companies that would do something similar like that in Dallas, but if the supermarkets don't step up to the plate, then that might be a viable option as well. Thanks.
Excellent. Ashley, you had a comment.
Yes, and one of those that I would add to that would be an entity called Gooder. It is Atlanta-based. Actually, Southern Dallas Thrives, along with State Fair of Texas and Communities Foundations of Texas, this past spring did a collaborative effort to bring them to the North Texas area. They are extremely innovative in their ways of approaching access to food, specifically in vulnerable communities. And we're working to bring them back for a longer partnership or collaboration over the course of the next 2 years, where they have figured out, combine some logistical aspects of ways of bringing sort of the integrity back to, the access of food through some innovative methods of pop-up grocery stores. They recently opened up one in collaboration with a celebrity over in the Atlanta area, providing relevant foods to various communities throughout the nation. And so that is an amazing partnership, and we're really excited to bring them to North Texas to continue the work.
Thank you. Beautiful. I appreciate that. I want a quick question for Pastor Carter. What kind of partnerships, public-private partnerships, could we expand from your perspective to help organizations like yours reach more people? What do you see that's working in your public-private partnerships, Pastor, that you think we could expand on? Mute. You're on mute. Can't hear you.
Okay, if you have the resources, we have the expertise to get the job done.
Good
You know,
answer. Good answer.
yeah. If you bring it, years past, we had a company that gave us $1,200 a month, and their goal was to put 5 pounds of meat in every box that we give out. And man, when they told us that, we went out to North Texas, looked at what each pound would cost, and we looked at it. We were able to put 5 pounds of meat in every box for 2 years. We did it. And man, that was big for us because a lot of food banks back then, pantries were not giving meat, but they gave us the opportunity to give meat. So if we collaborate with a private company, you know, it's able to help us to do more, to reach the people even better, and then have more nutritional food.
So you want to expand your partnerships with private corporations and others that could expand what you're already doing, because you're pretty good at what you're doing. You just need more resources.
I need the resources. That's
Got you.
it. Mm.
Excellent. Thank you. So Ashley, one other question for you. Can you imagine a city, county, or statewide, or perhaps even national legislation, and I think Ed touched on this, that should be passed or could be passed that would help our hunger fight from your perspective?
That would be great. Go.
So Dr. Earl, I will say overall, you know, there was a study recently done by USDA that found that the rates of food insecurity actually have not decreased since 2019. Now, I think it's important to note and keep in mind that in between that time, the nation has absolutely been crippled by a whole global pandemic, and we've seen rates of various needs specifically related to access to food rapidly increase and rise over the course of the last 2 years. And so we've also, you know, kind of in a counter perspective to that, we've also saw government assistance programs around access to food be more flexible and really attainable to service provider organizations that really allow them to effectively expand the number of people that they've been able to serve in the food access space. So we've seen this show up in areas like an increase in SNAP benefits, federal waivers that have really expanded children's access to food, increased EBT benefits, and also even food items and food box items being delivered directly to, you know, families' houses that have children or households with children.
Yep.
I think on the
Go ahead.
I'm sorry, I think on the philanthropic side as well, we've seen some really huge increases in the number of dollars that have been poured into local communities, specifically aiding around meeting the increased needs for foods for families. And then even some increased municipality and nonprofit collaborations that we really saw happen, an uptick of those over the last couple of years, working to directly address the needs that we see related to food access and lack of food access in our local communities. All of these things, I think, really collectively have shown what a vision of what the space surrounding food access could really evolve to when relevant legislation is passed, aimed at really targeting and addressing those needs.
Yeah, I think like the child tax credit has done a huge impact on child poverty, which has effect obviously on access to food and affordability and things like that. So we are at 5 minutes, and I see Mr. Edwards up there, and I'm wondering if he would like some closing remarks on the way out with this wonderful panel and really active. I really appreciate the viewers, so to speak, in your active chats and your questions. We'll do our best to answer them after the fact too. If we don't get time, we'll make our connection, our email and et cetera available, because this should only be the start of this conversation or the continuation of the other 2 weeks. If we're going to make progress and continue to make progress, we need to be connected, and that's the intent. This is not a one and done. This is getting to know you and figuring out how we can work together to make a big difference. So, Mr. Edwards, I defer to you.
Indeed, Dr. Earl, what an outstanding, thought-provoking, interactive, engaging session with fascinating panelists and all the work that they're doing. We celebrate and commend all for their efforts. Special thanks to you, Dr. Earl, and the audience for your incisive observations and engaging questions. Thank you, panelists, again, for your vision and your vigilance on addressing these issues as it relates to food insecurity. This is our final webinar for the 2021 Dallas Hunger Summit. If you attended all 3 webinars in our Ending Hunger series, then you know that there have been many important takeaways and powerful insights from our distinguished speakers and panelists about solving this problem together. So on behalf of the Dallas Coalition for Hunger Solutions, thank today's panelists again, Dr. Edward Rincon, Dr. Owen Lynch, Miss Laila Alkerich, Miss Ashley Douglas, Pastor Daryl Carter, Miss Alexis Baker, and of course, our distinguished moderator, Dr. Doric Earl. We thank you all and appreciate your time and your expertise. Would also like to thank the members of the Planning Committee for this year's Hunger Summit who served with me, Beth Dexter, Catherine Nicholson, and Kristen Chan. They have raised the bar for next year's Hunger Summit, so stay tuned. I want to also recognize the leadership team of the Dallas Coalition for Hunger Solutions as an amazing group of talented and committed community advocates who appreciate the value of bringing organizations and community leaders together to work in partnership. We can achieve so much more together through our collective efforts and working as a coalition. I especially want to acknowledge and thank Bernice Providence, who managed the tech for this morning's event. Thank you, Ms. Providence. I'm going to give a shout out to the head of the body. The coalition is the body, but everybody needs a head, and that head is Wainella Henderson Green. We thank you. I appreciate your dedication and your commitment. Who organizes the annual Hunger Summit and keeps our collective work on track all year round. So thank you so very much, Wainella. We really appreciate. Couldn't do this great work without you and your leadership. And thanks to all of you for attending today and for your commitment to understanding the social and economic challenges many of our neighbors face. We appreciate your concern for improving their access to healthy food. You can help us make great strides on this journey to end hunger and poverty and improve health by getting involved in one of the coalition action teams. Look forward for more information in your inbox in the incoming weeks about how to get engaged. Upon leaving today's webinar today, you should receive a brief pop-up evaluation form. Please tell us what you've learned, what we can do better by sharing those experiences with us, what you'll do and what you'd like to know more about, because your voice matters. And so that concludes our Hunger Summit for 2021. We want to thank all of you for your attendance and your participation. And we hope to see you next year. Be sure to tell a friend. Thank you again for attending today's Hunger Summit.
Bye-bye. Thank you all.